Good afternoon. Yes, we are afternoon. My name's Dennis. I'm the pharmacy director here at the NDI. I just want to introduce Angie Nadeau, my PharmD student from Butler University. She's going to be talking about gaming disorder.
Perfect. Yeah, thank you. Yep, so like you said, my name is Angie, and I chose to do my topic on gaming disorder for this month just because it is relatively new, and there'll be a few things that I feel like we'll all be able to learn today. So we'll go ahead and jump right in. So first, just outlining some objectives. We obviously want to cover gaming disorder, which I'll refer to as GD from here on out, and basically how it's addictive, why it's addictive, and kind of why it's classified as a disease state. And then we're also going to go over the signs and symptoms of the disease, as well as recognize the consequences it can have on patients themselves, and then briefly go over the treatment options that are available at the moment. So first, it's important to kind of overview addiction as a whole because the guidelines do kind of refer to it as an addiction itself, and there's a lot of overlap between addiction and gaming disorder and kind of the signs and symptoms, as well as definitions and criteria that patients have to meet. And so just to kind of highlight some of the similarities, we'll kind of start here. So as a definition of addiction itself, the American Society of Addiction Medicine does define addiction as a chronic dysfunction of the brain system that really involves the reward, motivation, and memory, but it also involves compulsive seeking regardless of the negative consequences it can have on patients' lives, others around them, and things like that. So there's really two types of categories that addiction can occur. We have substance use disorders, so alcohol, pills like benzos, opioids, and even caffeine and cannabis can also be types of substances. And then we have behavioral, which right now the DSM-5 only categorizes gambling disorder as the behavioral addiction, but now gaming disorder is now a part of that category as well. And then as far as how addiction is actually caused, it's a really complex pathway, but essentially using these substances or using these addictive behaviors really changes the chemistry of the brain itself, and it all stems back to the increase of dopamine that is released in the brain that kind of gives you that satisfaction. So even if we think about like a meal that we had that was really great, or an experience that we had that was memorable, that is all due to this kind of a pathway that makes us want more of that substance or experience and things like that. So that's kind of like the brief overview of that. And then as far as treatment goes, the first step is obviously detoxifying the patient, so trying to get them off the substance or the experiences that they are addicted to. A lot of these patients will require hospital management just because they may go through a withdrawal period, so they may need closer management per healthcare providers. And then we also have cognitive behavioral therapies, which involves group therapy, counseling, rehab centers, and things like that to give these patients more of a support kind of view and counsel them on how they can cope with their addictive behaviors. And then last line is your medication-assisted therapies. So these really help to reduce those cravings as well as target those withdrawal symptoms that we can see in patients. And so I listed out some of the treatment options here for opioids, alcohol, and tobacco as well, and those are just listed on the screen for your reference. But we do have quite a few options for current addictive behaviors that are already established. And now we'll kind of jump right into gaming disorder. But first, we will go ahead and start off with our first Kahoot for the day. So those of you that are live, hopefully you had time to sign in and make your avatar and name. If you are joining after we already start, you can still join using the game pin above. So we'll go ahead and start. So the first question is, how long does a gamer experience negative gaming behavior in order to be diagnosed with gaming disorder? Our options are 3 months, 6 months, 12 months, and 24 months. Perfect, yep. So we do have 12 months. I'll touch base with this here in a second. But those of you that got it right, congrats. Oh wait, I gotta see who got it right.
Not me.
So there's our podium at the moment. We'll come back to that shortly. And then just to kind of highlight gaming disorder and its definition as the slides are kind of loading, the ICD-11 categorizes or defines gaming disorder as a pattern of gaming behavior that could be digital gaming as well as video gaming. This is mainly characterized by impaired control over the gaming, where these individuals are giving priority to games versus other responsibilities in life, and it's sort of taking over their day-to-day activities, and they're not wanting to participate in their regular activities because of the need for gaming, and they also continue to want to spend more time with it even though they know there's negative consequences. So like I kind of already mentioned before, it is officially recognized by the DSM-5 criteria as an actual disorder, and I think that's really important to note. And it's also, or for those who answered correctly, so for them to be diagnosed, they do have to have at least 12 months of playing time to kind of qualify for gaming disorder. Then we'll go over kind of the criteria here in a second. But essentially, these individuals really feel unable to regulate or cease their gaming behavior because they want that need. And it also kind of heightens their intense negative emotions. So like they may become more irritable, more anxious, and things like that when they're not able to play. And so that's just kind of outlining what the disorder is as a whole. So then leading into the next question of, is gaming an actual real addiction? So when I was kind of going through all these different studies that were published, there's a lot of back and forth debate between different authors on if this should be an actual disease or not. And so the one argument is that this disease should not be qualified as a disease because it could be due to an underlying issue like depression and anxiety. And a lot of these patients are using games to kind of cope with those other underlying comorbidities and things like that. And so the flip side of that argument is that other genuine addictions like your alcoholism or gambling disorder and things like that, these are not discounted as addictions, even though these patients already have underlying comorbidities. And so addictions are really defined by the characteristics of the behavior itself and not what the patient already has before that disease was there. And so that's kind of why the DSM-5 decided to include it in their actual diagnosis and as like a different category of addiction. And so one of the studies that I did find is that gaming disorder is associated mainly with depression, with about 11% of patients having depression already, anxiety disorder around 9%, and then also alcohol consumption around 6%. So those are like the top 3 comorbidities that we do see with gaming disorder, which I thought was interesting. And then I also wanted to highlight 3 significant stories that I thought were interesting just to show how the consequences that could happen from this addiction. So one of the stories is that there was a gamer in 2005 that stabbed a friend to death when he found out that this friend sold a virtual sword. And the kicker is that it was only $738, which I mean, maybe a lot of money for some people, but to take a life because of that is a little extreme in my opinion. And then in 2009 in Ohio, there's a 17-year-old who was sent to prison because he fatally shot his mother and severely injured his father because they took away his Halo 3 game. So there's that one. And then the one that really stuck with me is in 2011, there was a mother who got 25 years in prison in New Mexico for allowing her 3.5-year-old daughter to die of malnutrition while she spent hours playing World of Warcraft. So it not only affects the people directly, but it also affects the people that they're surrounding. If they're mothers and they have kids and things like that, that can also be a severe impairment. So all that being said, gaming is a real addiction. It has severe consequences, and that's why I wanted to highlight this as a topic for today. And now we'll go into our second Kahoot for the evening or afternoon. So how many hours do you think Americans spend playing video games each week? We have about 8 hours, 10 hours, 12 hours, and 15 hours. Okay, we got one right. Let's see who it was. 15 is a lot. Okay, whoever K is, you're on the leaderboard right now, so right on. Perfect. Yes, so we'll kind of go into some more stats there, but we'll cover the 8 hours here in a second. Well, yeah, so I'll just start with that. So at the beginning of 2021, the average amount of time that Americans did spend playing video games per week was about 7.71, so about 8 hours. I don't know why it's... Okay. Well, while that's reloading, so I'll kind of go over some other stats while that's reloading. So yeah, Americans alone spend about 8 hours each week playing video games. And then of note, China also has the largest average time spent playing video games, and they have about 12.3 hours. So theirs is quite higher than ours in the US. And then in general, there's over 2 billion people that play video games worldwide. But as of this year in 2024, we are expected to pass 3 billion people playing video games worldwide, which I thought was interesting. So yeah, here's the slide back up. And then I mentioned that. And then of the general population that actually might qualify for a GD diagnosis, we only have about 0.3 to 0.1% of the population. But there's more recent studies that are diving into are showing higher prevalence of gaming disorder. And again, this is kind of like a newly established thing. So I think there's not enough studies out there yet to kind of make that definitive assumption, but there is more studies being done on this. All right, now we have 2 more Kahoots up. So the third question is, what do you think the overall prevalence of gaming disorder is? 0.1%, 1.2%, 2.5%, and 3.05%. And one of those answers may be there to throw you off. Okay. So yeah, it's about 3%, which we'll cover here in a second. Everybody stayed neutral. Okay. Next question. What is the average age of someone who has? Oh wait. I reworded it. Okay. The average of an individual that has gaming disorder is 24 years old. True or false? I forgot I changed that one. Okay, yes, so true. Let's see the podium. Okay. All right. So this is going to take a while to load, but yeah, so the overall prevalence globally for gaming disorder is about 3%. Just to put in perspective, it's about 60 million people, which is pretty comparable to a lot of the other addictive behaviors like I mentioned before. So we have some people who have substance use disorders, which that's 2.6%. OCD is about 2% as well. But gaming disorder is found to be lower than compulsive buying, but it's also higher than regular gambling itself, which I thought was interesting. And then the average age of a gamer itself, not with gaming disorder, is actually 35 years old, which I also thought was interesting. But then somebody who has actual gaming disorder, the average age was found to be estimated to about 24 years old, which that's how old I am. So that just was interesting to me. And then gender, this wasn't really surprising, but we do have 2.5 times higher the amount of males that do have gaming disorder versus females. But a lot of the newer studies that are coming out do show an increasing prevalence for females starting to have gaming disorder. I think that's just because the popularity of it is starting to become more common in the female world. So there's that. And then as far as geography kind of goes, I kind of mentioned that China does have the highest playing time, but those East Asian countries, including Japan, China, and South Korea, they have the highest prevalence, and that's mainly due to the fact that they have 24/7 facilities that are strictly for gaming. There's also they have esports teams and things like that, and they get money and prizes and things like that. They're kind of viewed as an actual sports team in those countries, which I feel like is becoming more popular in America now. So there is that kind of overview for prevalence. And then as far as diagnosis goes, a lot of research says that the diagnostics behind it mirrors a lot of the other addictive behaviors like I mentioned before. But there's an issue with some of the criteria with gaming disorder just because it is so similar to all the other addictive disorders that are already out there. And so a lot of those other current criteria are mainly applied to adults, whereas here we're kind of seeing those younger ages being established. So there is a lot of argument that the authors that I found said that there needs to be refinement for this criteria. But as of right now, the DSM-5 does state that this disorder has to cause significant impairment or distress in many different aspects of this person's life. And it has to, or it cannot include general internet use, online gambling, use of social media, or even gaming on your phone. So like Candy Crush, all of that stuff, like that doesn't count. This has to be strictly like video games, PC, things like that. And so, like I mentioned before, it shares a lot of common features and symptoms with the other diseases, such as those that are listed here. But the big difference is that they do have to have 5 or more of these symptoms within 12 months, like we answered for the Kahoot question earlier. So if they're lacking in different aspects of their life, so school, work, their daily responsibilities like house chores and things like that, that would be a sign. If they're having withdrawal symptoms from not being able to play games, or they're starting to get those negative emotions when they're not able to play, that's also a sign. If they have to increase their game time or game playing time to get the same level of enjoyment, they're giving up their time with other aspects of their life. They're lying about how much time they're spending on video games, and they're having a decline in personal hygiene. These are all different symptoms that we can see with this disorder. And like I said, they have to have 5 of these in a year. All right, so we'll have one last Kahoot question. What game do you consider to be the most addictive according to user reviews? We got Fortnite, Demigod, Rocket League, and Call of Duty. Okay, well, 2 of you got it right. Let's see the podium. C and A Dot got 3rd place. Congrats. K got 2nd place. And okay. So congrats to you guys. Thanks for participating in that. But yeah, so Rocket League is the #1 most addictive game per user review. So that's the only thing that that was kind of hard to come to a conclusion, I guess, because a lot of these things, they don't really gather a lot of analytics, at least that I was able to find, on stats relating to like how addictive a game is and things like that. So this is just based on the people that are actually playing the games. So Rocket League, which if you don't know, it's basically like a soccer game, but you play with cars, and you can like get power-ups and stuff and do like tricks and stuff with the cars to basically play soccer. It's soccer with cars. I don't understand it. And then Littlewood, I don't really know how to explain. It's like a hunter and gatherer kind of thing. So those are just some examples of the 2 most addictive games according to users. And then as far as like game types, which ones are most addictive, we have the first one, which that stands for massive multiplayer online role-playing games. So those were found to be 21%, which is equal to the MOBA category, which is multiplayer online battle arenas. So both of those are multiplayer. One's just battling, one's role-playing. And then the MMOG one is just multiplayer online games. So we can kind of see like the trend of the multiplayer games are more common amongst players as far as how addicted they are, which I thought was interesting. And then one other fun fact I want to throw out there is Fortnite does have the overall most hours played of all time at 96 billion hours total. So just to put that in perspective, 96 billion hours is about 11 million years, which is twice as long as humans have been around. So yeah, so I thought that was interesting, and I wanted to throw that in there. And then real quickly, we'll go over some of the consequences. We mentioned a few of them before, but we obviously have the sedentary lifestyle, which this can lead to a lot of different diseases like obesity, diabetes, coronary artery diseases. I mean, these individuals will lose track of time very easily, and so they can kind of forget to sleep or eat and take care of themselves. And so that is one of the consequences it can have. The lack of social engagement as well. So a lot of these role-playing games like we saw, like that was one of the highest played ones. Those kind of give the false reality of what life should be. So when these individuals go out into the real world and encounter certain experiences, they may not necessarily know how to deal with them. And so they can tend to isolate themselves even more. So that kind of leads to lack of social engagement. And then concentration and attention problems as well. These individuals will have this heightened focus on these video games, but then when it comes to anything else, they don't really want to do those activities like reading a book, learning in school, because all they're focused on is gaming. And then kind of back to my other point of they're going to avoid all these other tasks that an adolescent should go through. Because they have these role-playing games that kind of allow them to make their ideal life in a sense and have these ideal social encounters. And so they will then avoid these challenges and problems in real life because they don't know how to encounter it. And then this one's pretty self-explanatory, but increased aggression or violence, just because there are a lot of violent games and things which can kind of lead to that aggression and the anger and everything like that. And then we also have seizures because some of these games can have a lot of flashing, and not all of them, but they should now, but they don't include the flash warnings, and so that could be a trigger for patients that do suffer from seizures. It can also lead to stress injuries, so like eye strain, back strain, or even like things with the hands like carpal tunnel and things like that, that could potentially happen. So those are all potential consequences of this disorder. We don't have a code for this one. And then just to lastly kind of go over the treatment that is available for these patients right now. So the most common treatment for gaming disorder is going to be cognitive behavioral therapy. However, a lot of the long-term benefits for this is really unclear right now. And especially like in reducing the amount of time that patients spend playing is unclear and things like that. So other non-pharm options, we have the PICPADIC psychotherapy program, which is essentially an individualized psychotherapy program for patients that are aged from 12 to 18 years old, that they are in this program for 6 months and they have weekly sessions to kind of help with that. And then we obviously have group therapy as well. Now, as far as actual medications go, we do have some treatment options that have had some promising results. So antidepressants such as bupropion and Lexapro have shown some positive results. When they were kind of compared head-to-head in a trial, bupropion was shown to be superior than Lexapro, which was interesting. And then a lot of these patients will have a comorbidity of ADHD, so methylphenidate and atomoxetine are all medications that could be used, and they also have been trialed that show promising results. And just to kind of wrap up, there was another trial that I found that compared non-pharm to pharm and medications and to see if one was better than the other, and they were not statistically significant. So there really isn't like a right definitive answer of which one is better, but I think it's always best to start with the more non-pharm approach just to kind of help with the coping and everything. So, and I think that concludes the presentation. I will open it up to the floor for any questions.
I'll ask one. Didn't Butler open a gaming center?
Yes. They have an esports team where Metro Diner used to be.
Do you think that is, do they limit times, like the amount of time a student can spend gaming?
I wouldn't think so. I don't know that, but other sports would do the same. Like they wouldn't practice, they only practice a certain many times a week. But I guess like the players could choose to spend more time practicing outside of what like the team practice is. So I don't really think there's like a strict like guideline or rule for how many hours, but that would be my assumption.
Gotcha. didn't know if they looked out for something like this.
Mm-mm.
in
Not
the
to my
students.
knowledge.
No? We can bring it to their
I don't think
attention.
they do.
No?
It wasn't, when it was described to us, when we were going to colleges, I didn't hear any of that about
No.
limits.
No limits?
Yeah, it's open all the time, you know, that kind
Hmm.
of thing.
Okay.
Interesting.
I think Dr. Miller has a question online.
Sure.
Are they tying cell phones into any of these studies, their use, and how that may contribute or, I don't know, somehow affect the disorder?
Yeah, from everything that I was seeing, that's a good question. It was excluding cell phone use, so like anything like social media or like phone games were excluded. But I don't necessarily, at least personally, I think there definitely could be a connection there that isn't really studied. But I think for the purposes of gaming disorder and it being relatively new, they wanted to exclude everything else that was not strictly video games. But I think that could be definitely an area of topic for researching in the future.
Jeff?
Cool. Thank you.